have you heard of a drug pricing proposal that is supported by both Democratic and Republican senators? The American Association of Retired Persons, the American Medical Association, the Federation of American Hospitals, America's health insurance plans, 76% of the American people, President Donald Trump, and the Department of Health and Human Services. What kind of idea can this be that has that kind of support, bipartisan support in Congress as well as in the White House? Well, Senator Grassley and I have a simple amendment to the spending bill that is before us, which provides $1 million, small change by any federal standard, for the Health and Human Services Department to issue rules regarding price tags on direct-to-consumer ads for prescription drugs. While this underlying bill includes many important provisions that I support, it doesn't do anything to tackle prescription drug cost. And we know, American families know across the board, that it's time for us to act. If I ask you whether you've seen any commercials for prescription drugs on television, and you answer no, then I know one thing for sure: you don't own a television, because they broadcast an average of 9 drug ads that each of us see every single day. 9 a day. You know what I'm talking about. It's the ads with those unpronounceable names of the drugs, and then that long mumbling, don't take it if you're allergic to it, this may kill you, all the warnings that they give you at the end of the ad, over and over and over again. The pharmaceutical industry spends $6 billion a year so that we get a steady diet of these drug ads. How many countries in the world have television advertising for prescription drugs? 2, the United States of America and New Zealand. Each year, $6 billion is being spent for one purpose, so that finally, after watching an ad for the 45th time, you can spell Xarelto and walk into the doctor's office and ask if you can have Xarelto blood thinner rather than warfarin or some other version. The difference, of course, is that the Xarelto prescription drug costs $560 a month. And it may not be any better for you than the generic version that's a lot cheaper. You know what the #1 drug is that's advertised on television and sold in the United States of America? When I tell you, you'll nod yes. Here it is, Humira. Humira, it was designed to help people with rheumatoid arthritis, and that's a terrible disease, and people needed a helping hand. And then they discovered it had a positive impact on psoriasis. Well, psoriasis can be a terrible thing to suffer from, but there are a lot of us who just have a little red patch on our elbow who technically have psoriasis. So what I showed you here, you don't see on television, incidentally. How much does Humira cost? $5,500 a month. A month. You wonder why the cost of health care is spiraling out of control? $5,500 a month. And sadly, many of these high-priced prescription drugs are being prescribed by doctors when it's not necessary. And it drives up the cost of health care. It's why a major health insurance company in my state has told me they spend more money each year on high-cost prescription drugs than they spend on inpatient hospital care. Think about that. More money. And it's going through the roof, and there's nothing to contain it. So the senator from Iowa, with his Midwestern common sense approach to legislation, has joined with the senator from Illinois, who hopes to aspire to the same goal, to come up with a basic idea. If you're going to run a drug ad, put the price of the product on the ad. We'll know then what it really costs, and we'll also know when they start raising it again and again and again. Well, pharmaceutical industry hates this bill and this amendment like the devil hates holy water. They don't want to tell you what it's going to cost. They want you to go into that doctor's office and say, I just got to have Humira. There's this little patch on my elbow and I absolutely got to have it. And too many doctors write those scripts. So what Senator Grassley and I are trying to do is to give the American people more information about drugs and particularly their cost. We're trying to make sure that that information gives transparency to the transaction. And we're trying our very best to give the American consumers a break and perhaps start to slow down the cost of prescription drugs. This is a simple amendment, $1 million to the Department of HHS to issue rules requiring price tags on ads. One senator opposes us, one. We're trying our best to convince him not to oppose us. We think it's a good idea to move forward in this, and I yield the floor to my friend, my colleague, and my co-sponsor of this measure, Senator Chuck Grassley.